Hi, I'm Dr. Koushik. I'm consultant pediatric surgeon and a pediatric urologist at Manipal Hospital Sarjapur Road. I'll be talking about a condition called as vesicoureteral reflux. This is a urological condition where the urine from the urinary bladder travels up towards the kidney. Now imagine kidney and bladder to be a one-way road where the urine flows from the kidney along the ureter into the bladder. There is never in life that the urine traces a reverse path, that is ascending from the bladder to the kidney. So when this happens, that is urine entering in the wrong direction, that is called as vesicoureteral reflux. In this image, you can notice that the urine, instead of completely going down from the bladder, partially is also entering into the ureter. This is a normal ureter where the direction of flow of urine is only from kidney towards the bladder, but here it is ascending upwards. This condition is called as vesicoureteral reflux, and because there is excess urine getting collected within the kidney and the ureter, there is bulging of ureter and the kidney. So this is hydroureteronephrosis caused because of vesicoureteral reflux. This is a condition which can lead to multiple UTIs and damage to the kidney function. There are 5 grades in vesicoureteral reflux, from grade 1 to 5. The minor grades usually do not cause much of an issue, but the major grades causes swelling in the kidney, swelling of the ureter, and repeated urinary tract infection. This urinary tract infection can occur as early in infancy, even by 2 or 3 months of age. It is hence said that any child who has urinary tract infection before they are toilet trained, that is when they are less than 2 years and the child has a urinary tract infection, it is important to do an ultrasound test to detect hydronephrosis. It may not be just VUR but other pediatric urological conditions which is causing hydronephrosis, and hence an ultrasound is a must. None of the UTIs should be treated with just antibiotics, but an urine culture has to be done. Coming back to VUR, how is it treated? The bladder from the birth till the child attains toilet training and even up to 5 years keeps undergoing cellular level changes and also changes as a structure. With this, many a times the vesicoureteral reflux, especially the minor grades of grade 1 and 2, can get auto-corrected. Grade 3, 4 and 5 can come down in grade and become grade 1 or 2 with growth. So during this period, what we do is observe the child. We start the child on something called as a uroprophylaxis, which is an antibiotic low dose which is given, doesn't have side effects, and it is given only at night. This helps to prevent many urinary tract infections in future. Once the child is being followed up for a year or so and we see that there are no urinary infections at all, then the child can be safely followed up in future too, till he or she attains 5 years of age. If the child has repeated urinary tract infections even when on uroprophylaxis, then we also do DMSA scan, which is a nuclear medicine scan, and if this shows something called as scar on the kidney and this scar is growing both in number and in size, then these are the 2 criteria where we need to operate on this child. If there is none of these, then the child can be safely followed up till 5 years and see if there is an auto resolution of the condition. Coming to surgery, the surgery is called ureteric reimplant, where the ureter connecting to the bladder, the junction is operated, and we make sure that the urine doesn't enter back into the ureter. So vesicoureteral reflux requires a close follow-up so that the kidney function is preserved, the child doesn't have urinary tract infections, and it's a completely correctable condition if proper advice is sought and parents adhere to the treatment protocol completely. Meet a pediatric urologist and clarify any more doubts on VUR. Thank you.